Let's hear your story. So you are a native. Where were you born, in Siskiyou County?
Actually, I was born in Riverside. I moved to Siskiyou County when I was 11. So
okay, that's close enough.
Yes, exactly. I grew up for the important part of my life here.
Yeah.
And I actually had moved away for school and wasn't sure what I wanted to do. Nursing was never even in my mind.
On the radar.
And I had an injury, so I had to move home. And then I heard about the nursing program at COS, and so a good friend from high school and I applied together, and at that time it was luck of the draw, so I was number 11.
Wonderful.
And I remember her calling me. I was out of town and she was the first one picked, and then she told me that I was number 11, and so we were very excited to be able to go through that together.
Yeah.
And then I graduated the LVN program in 2007. I had been working at the hospital because I knew I wanted to try to work there when I was finished with school.
At Fairchild?
Yes, so I wanted to get my foot in the door. So I started in the business office, and then they wanted me to go be a tech in the ER, so I got to experience that. And it's funny that that's where I ended up being at the end of this. So I graduated the LVN, and when I was in the LVN program, they were in the works of creating the RN program here, which was excellent news because I knew that the Shasta College program was really hard to get into, plus, you know, being graduating from the LVN, I thought I had a good chance of getting into this RN program. And so I did, and I graduated in 2009, and the great part about being in such a small community is I really got to know the students I was in class with, and now I get to work with them as well. So we just get to grow together and watch each other learn, and it's just a great experience.
Fabulous. And so can we assume, I won't assume, does the friend, the high school friend that you went through the program with, does she work with you at Fairchild as well?
She is still an LVN, and she's actually in the RN program right now, so I'm going to be by her side encouraging her to make it through.
What's her name?
Nikki Autry.
Big shout out to Nikki Autry.
Yes, yes.
Wonderful news. We're very glad.
Yes, I'm very proud of her.
Nice. And so you were telling me earlier you work in the
emergency room.
Emergency
nights. So we get to see some exciting stuff in there.
I guess exciting is one word for it.
Yes, that is one word for it.
Nikki used to work at our office, so shout out.
Yes.
Oh, okay, there you go. And you live in Yreka?
Yes.
And so do you just imagine, you look settled, you sound happy? And,
I am very happy.
Yeah.
Very happy. And I am incredibly thankful that this program is such a good program. I feel like I have gotten as much preparation as I needed to be able to do my job safely and competently, so definitely a good program.
Lovely. You know, you're having been here then from the time you were 11 until you, see, 11 is a good number for you.
Yes, I think so.
Moved here when you were 11, number 11 in the choice, yes? And David, you were mentioning earlier something that you've observed about people who were raised here and their interaction with patients. You were mentioning that...
Well, a big challenge as a private physician in my office is to be able to hire, attract and hire, and retain a competent staff in the outpatient setting too. We usually use LVNs at the office. And the graduates from the program here have been an excellent source of local employees for us over the course of just the 5 years that I've been here. So we've never had to hire out of the area. We've never been understaffed for any significant period of time at the office, and that's all due to the program here. I mean, without the program here, I could imagine that life would be much more difficult for me.
And how do your patients like having local?
It's always a bonus. I mean, you know, some of these older patients, when they come in and they see the girl who grew up next door, who was literally 5, is their nurse at the clinic, that is a big source of pride and joy.
Very nice, very nice. What about in the administration? This is actually, I'm going a little bit off topic here, but what about in the administration? Are there people coming into Fairchild? Do you have some local recruitment even into administrative jobs? And how does that, in other words?
Well, we do, Deborah, and there are a number of examples that I could give. I don't think it matters whether it's in a non-clinical role, an administrative role,
Right.
or a clinical role. I think what you're hearing us say, at least from the employer's perspective, is that we find great value when we can establish an employment relationship with somebody who is familiar with the area, who has learned to enjoy the wonderful lifestyle and the many opportunities that this area has to offer. You have reduced turnover, which is tremendously expensive and burdensome to large organizations and small organizations. And so when you can find that goodness of fit, so to speak, between an employee and an employer, it lends to a longer tenure, and we think there's value in that. I think that when we talk about the Rural Health Sciences Institute, you know, two things. One, again, from our perspective, when you can offer an opportunity for someone like Amber, is part of our local community, to continue her education and have that initial training, in this case as a licensed vocational nurse, I think that's a wonderful thing. All right. But secondly, I think as we move forward in our partnership, it's not just about the initial training. I think there will be opportunities to continue to work with the college and with the Rural Health Sciences Institute to maintain that competence with the wonderful facility that they have, both the technology and the staff. And we are engaged in dialogue as we speak to explore further those opportunities to, again, not just provide the initial training, but to maintain that level of competency that we're looking for.
So, and similar, you're referring to what David was talking about earlier, the CMEs?
Yeah, or CEUs.
CEUs, right.
Tomato, tomato.
And additional trainings too. That was the point I was making before, is that this is my understanding, is that we'll be able to start and complete trainings in certain technical medical tech fields.
Because we need ultrasonographers and radio techs and, you know, cardiopulmonary people.
Right.
Laboratory
takes a village to run a hospital.
Definitely.
Do you have any memories, any strong memories of some of your practicals? I didn't get to ask the RN who was on with us last fall from Mercy, but I'm thinking of you as a student, and you've been working with mannequins and working with your instructors and your students, and then you're in the hospital.
I'm not sure if my strong memories are appropriate for
I see. Okay.
But I have great memories of my clinicals, and I think another thing that helped is when we did our clinicals at Fairchild, we also really got to know the staff. So then when I started working there, I felt very comfortable working with them, and it was an easy transition going from school to work. So I appreciated that.
And you, we're coming to the close of our time here, but you had mentioned earlier that you had to do some of your clinicals down in Redding. You had to actually leave the county. And Jonathan, you mentioned that you're in conversation with the nursing board, the California. Can you talk a little bit about that?
Yeah, right now we are approved as a clinical site for the LVN program. As licensed vocational nurses continue their education to pursue the RN degree, and then licensing through the Board of Registered Nursing, we are looking to be approved as a clinical site for that LVN to RN upgrade program. And so we're working closely with all of the key stakeholders to try and make that happen, so that as these students go through and as these nurses go through this program, that they can stay here and receive their clinical training at a local site and not have to travel and deal with some of those issues.
Expenses.
Yeah, expenses and the weather and whatnot. Right. And is Fairchild doing that on its own? Are you collaborating with the other hospital in the county, or how is that working?
And we're very much collaborating with the college, with the other providers, and with all of the key entities in terms of county and state.
Wonderful. Is there good news a short way ahead, or are you still too much in the negotiation? And
well, we are right in the middle of the discussion. I think we're optimistic that we can get this done, but certainly it would be premature to make any announcement.
We can't have any on today's show. The journalist in me goes, shoot. Okay, that's okay. Anyway, I appreciate your talking about it, because that has been part of the conversation about RHSI and about the RN, the upgrade, step up or whatever it's called to RN, is the difficulty about having to go to Reading. I've heard that for years around here, so I'm glad to know. So at least we have a little breaking news that we're now in conversation with the powers that be. Anything that's occurred to you as we've been talking that we haven't touched on yet? We all look at each other? No. Okay. You had talked about staff access to scholarships when you and I spoke. Does Fairchild offer scholarships for, can you talk a little bit about that?
We can. We have access to a number of different scholarship programs, primarily through the foundation at the hospital. And there have been a large number of the nurses and other staff that have been able to access these scholarship resources as they pursued additional training. So it really, I think, has been a great resource and is something that's frequently used.
And that's ongoing through, so the foundation, similar to the COS Foundation, fundraises and then makes those scholarships available.
Yes, in fact, I've actually used some of the scholarships to go on and get CEUs and be trained for things I needed to do in the ER, so it is very beneficial to have that available.
Very nice. I think that is important in our county. Yeah. Were there people in your class from sort of the off the I-5 corridor? Doris, Scott Valley, Tule Lake, McLeod?
Actually, in my RN program, there was someone from Walnut Creek, and there was a lot of people from Oregon, from Grants Pass and Medford and Klamath Falls. So
nice.
It was nice to see people gathering here to do our program, you know, rather than us trying to go out and find it. So. And
I think that as Jonathan and David have talked about, I think that as RHSI begins to mature and the program, the opportunities grow there, I think that we'll pull from around our area, from a wider area as well.
Maybe we can pull some physicians in.
It's hard, isn't it?
Wishful thinking.
Yeah, I know. We've lost a number of physicians just in Mount Shasta just in the last little while. It's very hard. Okay, well, I'm really appreciative that you came today and that you shared your experiences with us. I want to thank you very much, and we'll be showing this to the whole county. And of course, you can always watch our shows on mctv15.org. We stream live to the internet. And on that website also is a tab on the home page marked schedule, so you can find the schedule and find out what's on TV or the internet viewing. Thanks so much, and thanks for watching today's Siskiyou Spotlight, Rural Health Training with Jonathan Andrus, CEO of Fairchild Medical Center, and Amber Clapp, RN at Fairchild Medical Center, who came through the COS program, LVN and RN, Step Up to RN, and David De La Lana, who is a doctor and the Chief of Staff at Fairchild Medical. Thanks so much.
Thank you.
Thanks for watching.